We are less than an hour away from watching Facebook CEO Mark Zuckerberg begin 2 days of testimony before congressional panels. He's expected to face a barrage of angry questions about trust and user privacy.
And few things are more private than our medical information, but a recent report by CNBC revealed that Facebook had sent a doctor on a secret mission to ask major U.S. hospitals to share patient data. Joining us with details on that is emergency room nurse and clinical nurse specialist Alice Benjamin. Nurse.
Good morning.
Good morning.
Alice, welcome back. Good to see you.
Thanks. Nice to be here.
So who's the doctor involved in this secret mission? What was the intent?
Well, the mission's no longer quite secret anymore, but this is a Stanford cardiologist by the name of Dr. Freddie Ab. Now, the thing is, he's led other healthcare innovative projects at companies like McKinney & Company and Google. So it's interesting that he's now at Facebook working on quote-unquote confidential projects, and because he is a cardiologist, he has expressed, or the company's expressed, that this project had a cardiovascular focus. So it's really interesting to see the work that they're going to be doing, or think that they're going to be doing.
And so has something like this been tried before? And if so, what are the pros and cons for doctors and for hospitals?
Right. So this has been done before. So with technology, we have tried to optimize the electronic health record, tried to predict events happening, tried to predict when patients would benefit from certain services. And what Facebook was trying to do was they were trying to capture Facebook user data and marry that with medical information such as illnesses and prescriptions. So in the hospitals, we do that already. By being admitted to the hospital, you've given us permission to use your data to provide the best care possible for you. Now that works in the hospital, and what we do is we create algorithms. So for example, with the disease heart failure, if you meet certain criteria or symptoms that may indicate you have heart failure, the electronic health record, before a provider's even looked at you, can scan your information and then trigger an alert to the healthcare team to say, hey, I think Jessica might have heart failure. Please take a look at her. And then that'll prompt us to see you sooner. And then if the doctor does deem you have heart failure, with another snap of a button, we can trigger an entire healthcare team to do that. And so what we do in the hospital is what I believe Facebook and this physician were trying to accomplish in an outpatient setting.
And you say that when it comes to outpatient care, that sharing this type of data, though, gets blurred. What do you mean by that? Yes,
because when you're in the hospital, you've given us permission to use this. So, and I will say there is some financial motivation in some of this, along the disease process heart failure that I mentioned. So there's financial incentive to prevent you from being readmitted. So if we can prevent that from happening, we just need to communicate with you on the outpatient side. And the average adult spends 2 to 4 hours on social media. So if we can identify these people who might benefit from certain services or medications on the outpatient setting, perhaps we can offer those services and prevent you from being readmitted.
Okay. Well, what are two big legal problems that would have to be addressed if Facebook were to try to resume this plan?
Well, this was classified as research. So whenever we're doing research, you need express written consent from the participants, which Facebook hasn't asked any of us for that. And then as well, it's very important that we protect your patient information. Now, with recent events like the Cambridge Analytica situation, Facebook's demonstrated that they still have issues with maintaining their information. So even though we would look at a web designer or a company to protect that information, by that partnership with the healthcare professional and, Facebook, healthcare professionals can be just as liable if your information were to get into the wrong hands.
Wow, very interesting. Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for coming in.
Thank you, Nurse Alice. Good to see you.